Welcome to the Wild and Fierce podcast. We are your hosts, Amber
and Johanna. We're here to explore womanhood through real, raw, and unfiltered conversations.
Please remember this podcast is for education only and not a substitute for medical advice. Always consult your own healthcare professional.
Let's dive in. All right. Hello. Welcome back to the podcast. Today, we're going to be talking all about the mental, emotional, and energetic side of birth and why mindset is just as important, honestly, if not more important than physical prep. And we're super excited to introduce HeHe. She is our guest today. She's an evidence-based birth doula. She helps educate women on how to have a positive hospital experience, provides so many educational resources through her Birth Lounge and her own podcast, the Birth Lounge podcast. We just looked and she has over 355 or 350 episodes. We were like, how do you do that? And we're going to add everything in the show notes. I'm also kind of fangirling. I've been following HeHe for years now. I don't know how many times. I don't know how many times I have sent your reels and your humor to my husband, and I'm like, oh my God, this is so good. So definitely fangirling. She's such a joy to talk with, and I can't wait to dive into everything. So welcome, HeHe. Amber, do you want to go ahead and take it over?
Yeah. So HeHe, we were talking obviously off camera. We just want you to share who you are. What is a doula? What does a doula do? Just share your story with us and the listeners. And yeah, we're going to kick it off to you.
Oh, thanks, you guys. Thanks for the warm welcome. And, I'm just a regular girl. I'm just what you see is what you get on the internet. I'm truly one of those content creators that show up in real time and show up as I am. And I'm the same person online that I am offline. I am, as you mentioned, the founder of Tranquility by HeHe. We're a concierge service, which is a little different than traditional doula care. We're a one-stop shop for families. And so we do all of your prenatal care, your birth care, and then your postpartum care through the first year of your baby's life. And that includes really kind of anything that is going to pop up during those times. So we do the traditional things like prenatal education, childbirth education, helping you make your birth plan, understanding your options. But we also do a little additional things like helping prep your partner. We actually have 10 prenatals with you rather than the traditional 1 to 2, maybe 3. We'll go to your prenatals with you. If you're having a hard time in your prenatal appointments advocating for yourself, we are not shy to say, would you like us to join a prenatal or two? In your birth, obviously, we're there and we're helping you advocate. We're doing pain relief. We're helping you with strategies to cope. We're helping you know what your options are during each of the decision-making points as well. And then postpartum, that also includes, mom and baby care, obviously, that emotional support. But in addition to that, feeding support, baby sleep support, breastfeeding support, nutrition support. So there's so much that goes into that postpartum that I think a lot of people don't realize. And that's why it's really important to me when I created my company that, it was a full spectrum thing. It was start to finish because I think sometimes in pregnancy it can feel overwhelming with the number of practitioners and clinicians and providers that you see, but in postpartum, especially because you've got the lactation consultant, you've got the mental health counselor, you've got the massage therapist, you've got the PFPT. And not to say that we take place of any of those people, but to say that you may not need as a robust team as you would otherwise because our team is able to provide you with a lot of support and education that you might be piecemealing together if you didn't have such a comprehensive care. In terms of my background, so I have a unique background, and I always say that birth work found me, and I did not really find birth work because I started in early childhood education. My master's is in human development and family studies, and I thought that I would be in the classroom forever. I love teaching. Like, I love teaching. I'm just a natural born teacher. I love watching people learn. I love watching them learn and then apply what they know. I love watching people learn and apply what they know from what I've taught them out of a textbook. And I'm like, oh my God, this is exactly what the textbook said would happen. Like, it's just so cool for me. Everything is full circle. And so I spent many years in the classroom and early childhood sector, and that grew very hard on me being in a sector that I felt like my wings were constantly clipped. And so then I got into birth work, and someone that I worked with was like, you would be an amazing doula. I took a weekend course and I realized two things. A, my background is perfect for doula work. And B, the weekend course that trains doulas at that time, it was 10 years ago, of course, it was very shallow. And I felt like, gosh, we're giving people 16 hours of care, of education, and then we're going to send them into the most pivotal time in a
Yeah.
woman's life to help her have a baby. And it felt, for me, I was really grateful that I had the background I had. And it also made me realize there were so many gaps in care. And so that's where that concierge support came from. I do think it's important to note, too, that doulas and clinicians are very different. A lot of times people will think doulas and midwives are the same thing, and they are not. I think everyone understands the difference between a midwife and an OB, but they're actually more similar than a midwife and a doula is, right? Because a doula is not a medical professional at all. We don't do any clinical work. We're not going to be checking your cervix. We aren't going to be given any diagnosis. We don't have prescriptive authority, where your midwife and your OBGYN do. They are medical providers. A doula is going to be more someone that does educational support, that emotional support. They're there for that advocacy support. They're helping you kind of understand your options. So a really great example is, you might have a kind of a prenatal where you leave going, "Oh, that didn't feel awesome." I had said that I didn't want to be induced, and my doctor or my midwife had said when I left that they were still going to put that on the calendar. I don't know if I have to show up to that or not. Your
Mhm.
doula is a great person to rely on at that point. Call them up and say, "Hey, I just left my prenatal and I feel kind of icky about the interaction because I felt like I had shared I didn't want it. I felt like I was really clear in not only my preference, but why I didn't want it. But my doctor or my midwife still put it on the calendar. And so now I don't really know what that means. Do I have to go? Am I allowed to say no? Would it be neglectful or negligence or unsafe for me to not show up or for me to call and cancel this?" And your doula will be able to help you understand what your options are. Now, of course, you know, depending on your individual factors and your health history, will kind of determine the answers to those questions. But for the most part, we know that elective 39-week inductions, unless it's a preference by the mom, doesn't really have too many benefits. And it actually does have a great number of risks that oftentimes are either not presented, or they're presented in a way that really downplays them and often misrepresents what those risks truly are.
Yeah. Yeah.
I want to highlight something that you just talked about with that because I feel like one thing that you really advocate for that I see on your page a lot too is true informed consent. Can you explain what that is really quick when you're talking about like inductions? Because I don't feel like that's something that maybe a lot of women understand. We're in this world where I feel like we trust sometimes too blindly our providers and we don't really get all the information. So can you explain informed consent from your perspective?
Yeah, and I want to take away the blame of, blindly trusting your doctor. I'm 34. So I think, 34 years ago when we used to watch our parents go through the medical system, it probably was a little bit more acceptable to just kind of blindly trust. And I think the medical system was different. We really saw a shift in the medical system when insurance started to play a huge role. And so now, instead of it being a people centered industry, it's very profit driven. And so that has changed the responsibility of the consumer. And so, if you're someone who blindly follows your doctor, I don't think that you're doing anything wrong. I just think you have more power than you probably realize. And that's what I really aim to kind of show people. And so, when we're talking about informed consent, there's a couple of pieces to this. Number one, the transparency of information has to be there. So if your doctor is withholding information in any regard, whether that be intentional or unintentional,
Mhm.
it's not true informed consent. It absolutely can't be. The second piece is you have to be able to be freely asking questions. So you should be able to ask about alternatives. You should be able to ask about pros and cons, risk and benefits. You should be able to challenge them without them bringing in their ego or fear-based language or trying to coerce or manipulate you in any way or trying to sway or influence your decision. And then the third part, this is really where we get hairy. So the first part is, that information, a lot of times we're getting it pretty good. The second piece is a little harder, but the further we get along in 2025, we're kind of good at it. We've got some practitioners out there that can really check their ego and not bring it in. But this third piece is really where we run into problems. You must be able to decline anything and everything. It is the law and it is your human right. It's just medical freedom. And so, without medical freedom being present, without the ability to freely decline, you cannot have informed consent. They're like peanut butter and jelly, salt and pepper, right and left sock. You cannot separate them because they innately go together. Without the option to decline, it cannot be informed consent. It's coerced consent because that person now feels like, well, I can't decline, so I basically am forced into saying yes, and that's not consent at all. If we were to think about consent in any other regard, romantic relationships, sexual relationships, a workplace relationship, consent is you have the freedom to say yes or say no without outside influence. And like I say, I think that third piece is just really hard to come by, and it takes a very special practitioner to be able to sit there, make a clinical recommendation, have a good, solid, valid reason for their recommendation, have their patient decline that and still say, okay, I trust you. I trust you to make a different decision than what I'm recommending, and also probably what that practitioner would make for themselves if they were making this decision.
Yeah.
I think this is such a huge topic and
Yeah.
something that I talk with my own clients about because I think there's also times where we feel like we owe that provider something. If they don't let us make that decision on our own, that we feel like we're stuck with them. And this is where I do encourage my clients, you can find another provider. This is where you like shop around, find a provider, interview providers, ask these hard questions. And I think that's where a doula can be life-changing to help guide you through those questions of how do we pick the right provider is
Yeah.
huge.
And that's hard because in theory, we love it and it sounds amazing. And in a country that had adequate medical access, it would be as easy as that.
Yeah.
You guys live in a place where you don't have proper access. I grew up in Mississippi. We didn't have proper access. There's so many healthcare deserts in our country. You don't
Mm.
have proper access. I'm lucky that I live in Boston, so I do have a plethora of practitioners and providers and clinicians around me. So if I don't like you, you're right. I never have to see you again. I can literally go next door. Unfortunately, that's not the case for everybody. And that's really where it gets tough
Yeah.
is, if you are really with the only OBGYN who is quote unquote in your area, VBAC friendly or twin friendly or trained in breech, and they are treating you disrespectful. They don't listen to you. They don't truly believe in consent. They don't really honor your autonomy. And your next provider is 4.5 hours away and possibly across state lines. Woof, that's really tough. I mean, now you're stuck between, do I stay with this person who I clearly am not safe with? I mean, it's just not a safe provider, right? Or do I drive 4.5 hours and possibly across state lines to get medical care that I deserve? That is no place that anybody ever deserves to be, but it's a brutal reality for a lot of Americans.
Absolutely.
I didn't really realize that. So I'm actually in a different area than Amber, and we have very great birth
Oh,
resources.
good.
Like we
Which
have
is wild because we're only a
fantastic.
few hours away.
We're only, yeah, 2.5, 3 hours away. And I didn't realize how lucky I was until I started like thinking about pregnancy and birth and like options and stuff like that. And I'm also on a state line, so I can go to Washington State or Idaho State, and we have different options that way too. But we have a very big home birth community, a very big birth center community with pretty great hospitals as well. Not to say that there's not still issues, but resource wise, we're very fortunate. And then it's so interesting. Like Amber lives in an area where there's no midwife that'll take a VBAC.
No twins,
And
no breech burst, nothing.
yeah. So she's in definitely more of a desert. And I'm like, man, come to my house once you're 38 weeks pregnant, like help
Yeah.
birth here. But it's kind of crazy I wouldn't even consider Amber, in Wenatchee, like central Washington, that doesn't feel like a desert. Like it's populated enough that you'd think that there'd be plenty of resources and
There's
options.
not.
But how many midwives, like out of hospital midwives, are there? Like two, three?
That actually practice out of
Yeah,
hospital, three.
yeah.
Yikes.
And
That's it.
it's Wenatchee is 55,000, and then East Wenatchee, what, like
Well,
20,000,
and the
30,000?
other thing is there's a whole bunch of little towns around us. So it's a
Uh-huh.
big
It's a really big area.
population.
Yeah.
Big population. Then if we start talking like doula resources or like OBs I actually trust, like we're talking a very small number of people.
Yeah. It's wild. So it's, I think that's where it's like you kind of hear like deserts, like you'll hear like food deserts or, like medical option deserts. I don't think you think about an area that might have like 200,000 people,
Yeah.
which
I
is
think
crazy.
a lot of women find themselves in this situation when it's too late,
Yeah.
right? They're already in their second trimester finding out, oh my
Mhm.
God, my OB sucks. This
What's that,
person
it's that like bait and
OB.
switch where you think they're on
Totally.
board and then it's like, whoop, what just happened?
Yeah.
Or you stuck with the provider that you went to when you were 14, when you
Yeah.
started your period, And that's just been your OBGYN. So you just figured you'd have your baby with this person, not ever thinking, well, do they respect me? Do they honor consent and autonomy? What's their philosophy around unmedicated birth, around epidural, around upright labor, around forceps, around going past your due date, around going past 42 weeks, around declining an IV, around stirrups? I mean, there are so many things. And it doesn't stop there. It's in pediatricians too.
Oh
Hmm.
We're
yeah.
having people across the nation be kicked out of pediatrician offices because they're trying to have a better relationship with vaccines.
Yep.
Something that's not just standard across the board. They're just simply asking for medical freedom and individualized care. And if you don't follow exactly what the CDC says, no matter how educated you are, no matter how flexible you are in terms of like still doing the full schedule, you just want an alternative schedule, kicked out.
Yep.
So we've got practitioners who would literally rather leave you with no practitioner, no health care, than to be flexible and give you individualized care. That is something I can't wrap my head around. I cannot wrap my head around being a medical professional, which I am not, and thinking to myself, well, this person isn't doing exactly what I would do or exactly what I say, so I'd rather them have no care.
Yep.
That's insane to me and
I think
so
a lot of it connects back to the insurance stuff too when it comes to that
Well,
part.
I was just gonna say even
I think it's
licensure
part of
too,
it
because a
too.
lot of them are being told that they'll get their license taken away, which I know midwives like deal with that as well if they like practice out of scope, and sometimes you can get midwives that'll touch the boundaries or cross the borders a little bit, which we love. But I think pediatricians, they're actually coming into that a lot of
It's just so
like
sad.
it
job
is. It
loss,
really is.
which is like they're between a rock and a hard place too. Yes, I think there's some nasty ones out there,
Yeah.
right? For sure. But then I also think that there's a lot of really great ones in all professions, but they're really stuck between a rock and a hard place because of insurance, because of licensure. And then the people that are suffering though are everyday Americans just trying to get help and
Yeah.
trying to get
Moms
like
and
help with their
babies.
provider.
Yeah.
Moms and babies. I mean, the
Yeah.
people who make our nation
Yeah.
run,
Yeah.
you
Totally.
know, almost for free. A lot of
Our
times
world.
free.
Yeah.
Yeah.
Totally. I mean, and it's such unpaid labor. It's really insane. I learned a few months ago that pediatricians can only have so many exemptions that they can write.
Yep.
And if they write more than that, then they are in jeopardy of being in trouble, having finances pulled, being investigated, having their license revoked, all sorts of repercussions for these providers, just simply honoring medical freedom
Yeah.
and the rights of parents, which
Yeah.
is absolutely insane and really unfortunate for the American people
Yeah.
because if we're really going to rebuild the trust in the healthcare system between the American people and the healthcare system, which I do fully believe is possible, but it's not going to be done this way. We have to change
Yeah.
the way that we're approaching it because
Yeah.
right now, the healthcare system, it's only driving a wedge further between the American people. They're
Yeah.
just destroying any sort of hope and relationship and trust that they have right now. And that's really hard. It's a hard place to be.
Yeah.
My husband and I were having a conversation the other day. I'm not going to give the exact number because I'm going to butcher the statistics, but it was talking about the amount of people nowadays that trust their provider compared to who would go to AI, ChatGPT, or a trusted friend for
Mm.
true medical advice before they would go to a healthcare professional. And the numbers were astounding of the people that would prefer to go to a friend or the internet or something like that over trusting their provider, which is a scary thought.
Well, I don't have a
Terrifying.
PCP. Like my husband doesn't have PCP. My parents kind of do, but it's like we don't because like luckily I doing what I do for work, I understand blood work and I understand health stuff pretty well, and so that can get us by and I can catch red flags, but I can also cut through the BS if I am in an appointment with someone that's like trying to not give us full information. But it's yeah, like I my husband and I aren't doing that because and that's why I went down with the midwife that I'm doing working with because it's I just don't trust the system. And I think the individuals get blamed a lot. And I do think that, yes, there's poor individuals out there 100%. But I think that the system is just so anti-health, so anti-care. And it's so funny, it's because it's called healthcare. It's so anti-prevention and it's so pro-profit. And I don't think the average person, I shouldn't say I don't think, I know that the average person does not understand that. And they think that it's all the most like genuine, truest intentions. And rightfully so. Like we really want our providers to have great intentions, right? It can be very hurtful when they don't. But it's a really interesting system. And I feel like probably for us three, and I'm sure many of our peers feel kind of like we're trudging through mud when it comes to actually making a change in things because it's holy cow, like yes, we're changing the lives of maybe our Instagram community or changing the lives of like our clients that we're working with, but then you like I'll go to a wedding and hear friends' stories and I'm just like, oh my God, I feel like I'm just like getting stabbed in the heart with what I hear and they don't even understand the coercion that's happening. So it's tricky. There's something I wanted to touch on, and then I think we should move into the actual mindset side of things. But I do think that coercion happens so innocently, or it can come across innocently. Like, for example, a few years ago, I had a complication with my IUD. I went to the ER and they were basically like, oh, we need to remove this now. You need to go do a DNC in order to clear out everything that's going on. There was no talks of we can wait to see if you pass things on your own, or there was just no alternative options. And it happened to be the option that was given to me also made them 14 grand. But in that moment, it felt very supportive and very like they had my back. They were giving me all the options. It wasn't until last year, this is 3 years later, that I was like, I started learning about informed consent and hospital policies and stuff like that. And I like couldn't eat and, all the things in the hospital. But there was so much that I was like, wow, it didn't feel that way in the moment at all. But now knowing what I know and I look back, there was a ton of coercion, whether it was intentional or not by a provider. So I think it'd be really interesting to get your take on what are some of the most like common things that are done with women that are it's like actually coercion, but it may not feel that way, or anything that like kind of comes to mind in that arena. Because I think so many women are like, oh, I had a great birth. Like Amber and I talk all the time. We're like, God bless these women that like we think had a horrendous birth experience, but they like loved it because they just didn't know. So I'd love to hear your take on that.
And it's so funny how the perspective of a birth can be different for every single person in that room. Us as doulas, we have a perspective, that OBGYN has a perspective, the nurse has a perspective, that parent has a perspective, the mom, the birther, their partner has a
Mhm.
perspective, right? And if that
Mhm.
partner is male, then they have the perspective of a man. It's just all so interesting. When it comes to coercion, I do think you make a good point of the unintentional versus intentional. And I think this is really convoluted and it's something that you have to kind of unweave as the consumerist. Do I think that there's malintention behind this? In your case, it didn't really seem like there was malintention. For me, it sounds like hearing that story they were taught a certain way, and the hospital taught them to deliver this information, and it just so happened to be a very profitable
Yeah.
option. And the hospital probably didn't take the time to educate them on, okay, there are other options, and we do have an obligation ethically, morally, professionally, medically to present these and offer them to people. In terms of birth, I mean, that 39-week induction, it's often just presented as, oh, your term, let's do it. Let's get your baby out, And if you don't know enough to say, well, wait a minute, do I have to? Or, well, wait a minute, are there any risk to this? Or, well, can't I wait for spontaneous labor? Or, I don't know, does that increase my baby's risk for being in the NICU because we're pulling them out early? Yeah, it does. You have risk too as the
And
mom.
C-sections, yeah.
Totally. Oh my gosh, C-sections, interventions, forceps, and vacuum deliveries, long labors. I mean, we're talking inductions rarely are shorter than 3 days, where if you will just wait for spontaneous labor, the average first time mom is 24 to 36 hours to not even 2 days. And then beyond that, they just usually get shorter and shorter. Third time babies are what we like to call wild cards. So sometimes you have a third time baby that like trips you up a little bit. But for the most part, the more babies you have, the easier, smoother, quicker, faster your
Mhm.
labors are, right? And it's just kind of the way of the human body is very smart. It remembers, it hangs on to the skills that it's already learned. And I always like to say that little road has already been paved by your first and so
Mhm.
your other babies, they just follow suit.
Have you, I'm gonna add real quick, have you seen the slip and slide thing of like actual video of my first versus my second? And the first is just like slowly going down the slide, and the second like actually rapidly goes down and gets launched. And all of my mom friends are like, yeah, this is true.
Which is, we love that, right?
Yeah,
If you put in all this work for your first birth and
yeah.
then your second one just
Slides
literally
out.
flies out, it's
Perfect.
amazing. Yeah, perfect. Let's have five more. We love that. In terms of coercion, another place is cervical checks.
Yeah.
So, two things about this. Cervical checks in pregnancy are often presented as non-optional. So, all right, we'll take your pants off. We're going to check you today instead of all right, you're 38 weeks. Do you have any interest in being checked today? There's not really much benefit. It would give us an idea of what your cervix is doing right now. It doesn't tell us how long you're going to be pregnant for. It doesn't tell us where you're going to go into labor. It's also very normal and expected, and you should not have any big feelings about if your cervix is completely closed, high, and dry. That would be very normal. I wouldn't be concerned at all as your medical professional. And if you don't want it, there's also no problem in that. It just is data. I don't even know if we necessarily need it at this point, but I wanted you to have that option. That's so easy. And it
Yeah.
literally took me less than 60 seconds to say that. And so for doctors to say, oh, I don't have time. Okay, well, if you don't have 60 seconds to give true informed consent, you should reevaluate a lot of things about your life. Are you appropriate to be a doctor? Are you overworked? Are you working at the right place? Are your morals and your ethics in line with what your goals are? We got a big problem there. The second thing is cervical checks being presented that same way in labor. A lot of times they'll come in and they'll already be putting on gloves and they're like, okay, it's been 2 hours since your last check. So go on and lay on back for me and splay your knees open. Excuse me, right?
Imagine if a man, I was cracking up when you said, okay, take your pants off, I'm gonna check you. Imagine if a man came up to us and was like, I'm just gonna do that to you. Or like your
Just
mom
take
or
your
your
pants
best
off. It's
friend.
time for sex. Take your pants off. I'm gonna have sex with you right
I'm
now.
just gonna do this right now.
Like, excuse me, what?
Yeah, but then we
Actually,
like give our power
no.
away. Yeah,
Totally. Well, in that case, it's not even giving it away. It's that medical professional has come in with such dominance, such
yeah,
authority that they've actually taken your power and you don't realize it a lot of times.
yeah.
Women don't realize, wait a minute, hang on one second.
That's mine.
Yeah, I actually have a choice here because
Yeah.
it's presented as non-optional. And so instead of that, a provider in labor could say something like, okay, it's been 2 hours since our last exam. Typically, according to hospital policy, it's time for another one. However, if you don't want it, we can certainly put it off for another couple hours. Do you have any questions? Do you have any desire to have another one? There are some risk and benefits. Do you want to hear that? And I can tell you a little bit about what data we might get from the cervical exam and if it would help you make decisions going forward, right? And now that provider has opened up that conversation and That mom may say, I'm not interested, I don't want it. Cool. That is where the conversation should stop. We're not
Mhm.
trying to convince her, well, you can't really say no. Well, if you don't do this, your baby might be, well, there is no well. She said no after you offered, period. She said no,
No
right?
means no.
Um,
We've had that shoved down our throats. No means no.
I mean,
Yeah.
except in the medical setting.
Yeah.
No
Yeah.
means no, except everywhere
But
inside of a hospital, right? Where no means I must not have presented that right. I didn't push hard enough. I haven't scared her far enough
I
to
was literally just going to
say yes.
say there's so much fear mongering that I feel like
mhm.
enters the hospital setting.
Yeah.
So much.
Totally. And the informed consent, the assumed consent that, well, why are you here if you're not going to let us help? Because I'm allowed to be here, because I'm a
Yeah.
paying customer, because
Yeah.
I chose to have my baby in this hospital, but I didn't choose to have every Tom, Dick, and Harry put their fingers up my vagina. I'm allowed to do that. I'm
Yeah.
allowed to literally be here and say no to things that don't feel aligned to me or don't feel safe to me,
Yeah.
right? In the same breath of the cervical exams in labor, in pregnancy, sometimes you consent to a cervical exam and a provider will take the liberty to do a sweep unconsented. And this
Yes.
is something that really grinds my gears
Me
Can you
because
too.
can you
it
explain what
is
that is?
assault. Yeah,
Thank you.
absolutely. So, for anyone watching, you have a cervix and it's a circle, and you have to be about a half a centimeter to a centimeter dilated because the tip of your provider's finger has to go through your cervix. We need to get inside of your cervix, and they're going to hook their finger around the muscle. Your cervix is a sphincter, so it's a circular muscle. They're going to hook it around, and they're actually going to sweep all around your cervix from top to bottom, left and right, all the way around that circle. And we're going to be breaking membranes and blood vessels and connective tissue, and it is going to stimulate oxytocin. Not a ton. It's not going to be like when your water breaks or if you were hooked up to Pitocin. But if you are needing a little push over the edge to get into labor, or you want to nudge your cervix along just a little bit with a little bit more effacement or a little bit more dilation, sweep has the potential to do that. It's not always successful. And actually, the success rate is about 50-50. So you may land in the 50% that it is successful, and you may land in the 50% that it's not successful, which 50-50 sucks because it's
Yeah.
so unhelpful. I'd rather
Yep.
it be like 70-30, 40-60. I mean, even 55-45 would
I was
be
just gonna say even like 51-49.
literally like 50-50 is the worst. But, a sweep it's a tool, but it is something that is very separate from a cervical exam. They're two different procedures, and just because you get consent for one doesn't mean you have consent for both.
Yeah.
And I think that this is a place where a lot of women not only get taken advantage of, but they feel taken advantage of. And for any doctor to take the liberty to do a procedure without consent just because they were already up there is so unethical and dangerous. It's like beyond me. And that is what they'll say. Well, I was already up there, so I just did a little sweep. And it's what?
Yeah.
That would never, in a sexual situation, you would never say, well, I was already down there, so I just went anally. That would never be okay. You would never be
Totally.
like, totally, we're good.
That is like the
Right?
perfect example.
It really is. And I know there's a lot of people who are like, well, this isn't a sexual relationship. I
It is.
understand that. It's
Well, it
even worse
isn't, but it
because
is.
it's a professional
Exactly.
relationship,
Yep.
right?
Totally.
You are someone that is getting a service from this person. You don't have a love connection. You don't have a romantic relationship. You don't even have that intimate trust. This doctor, midwife, clinician, provider is serving you. That's a very different relationship than a romantic relationship. And they owe it to you to get your consent, even more so, which it is incredibly important and never okay for things sexually with a romantic partner to happen unconsensual, but even more so
Yeah.
with a professional relationship, right? Like you are the driver of that ship.
You're pregnant and everyone keeps asking, are you ready? But honestly, you don't even know what ready means. Your doctor keeps mentioning your pelvic floor, but doesn't explain what it actually does. Your birth class covers breathing techniques, but you're still confused when to push and when to wait. Your friends share horror stories that leave you more terrified than prepared. Meanwhile, here you are Googling how to write a birth plan at 2 a.m., wondering if you should ask for an epidural or try to go at it natural, and completely overwhelmed by conflicting advice about postpartum recovery. You want to feel confident walking into the delivery room, or maybe a home birth or a birth center. You want to understand what your body needs to be strong for labor. You want a birth plan that's actually useful, not just wishful thinking. And you definitely don't want to be blindsided by what comes after baby arrives. That's exactly why I created my birth prep and postpartum recovery course. This isn't just another generic birth class that treats all women the same. This is a step-by-step guide specifically designed for your female body and your unique birth experience. I'll walk you through exactly how to prepare your pelvic floor and core for birth, not with generic Kegels, but with targeted exercises that actually work. You'll learn how to create a birth plan that's flexible, but also powerful, and how to advocate for yourself when it matters most. Most importantly, you'll discover what postpartum recovery really looks like and how to set yourself up for the strongest comeback possible. Instead of feeling anxious and unprepared, you'll feel confident and empowered. Instead of hoping for the best, you'll know exactly what to expect and how to handle whatever comes your way. For just $79, you get lifetime access to everything you need to prepare for birth and beyond. That's less than what most people spend on baby gear that you'll use for only 6 months. Your birth experience matters, your recovery matters, and most importantly, you matter. Check the show notes for the link to purchase and transform your pregnancy from overwhelming to empowering today.
I want to wrap this up, but I have one more thing that I
Oh,
have
go
to
for it.
say about the like unconsented care, or the places that we kind of fall down the slippery slope, and that's pushing on your back. So there are so many times where women will say, I don't want to push on my back. I don't want to push on my back. I don't want to push on my back. They are working beautifully on hands and knees. They're in a squatted position. They're working with a birth bar. And the provider just says very simply, it doesn't feel like coercion. Could you lay back just for one contraction? I just need to be able to see down there. I'm really not able to deliver your baby in this position. So, what they've done there in that way, or in that scenario, is they've put the onus on you for skills that they're claiming they don't have. So, you're an OBGYN, you went to medical school, then you did residency, and now you're a practicing physician and you can't deliver a baby on hands and knees, that's not my problem. That seems like a problem with your education. That seems like a problem that you made it through so many years of school and you didn't learn the skills that you needed to learn. I cannot help you there. What you should do is get somebody in this room that can deliver my baby in hands and knees. I don't have to get on my back. I don't want to be on my back. And ACOG recognizes that and acknowledges that women should birth in the position that feels best to them, not feels best to your provider. And if they say something like, oh, can you just do it for one contraction? It doesn't feel like coercion, but the problem is once you're on your back, it's almost impossible to get up. I mean, you just have to go against them because they're going to be saying, oh, you're pushing great here. This looks awesome. I can see everything. Here comes your baby. And you are going to have to override that and say, no, I want to get up. And I am getting up. And sometimes you run into providers who say things like, well, you can't really get up right now because you're pushing your baby out. Well, you can, but you have to know that in your heart, and you have to have the gumption to get up and say, I hear you, and I'm still choosing to get back on hands and knees. I gave you one contraction, you got your one contraction, back to the birth bar I go, right? And that's really hard. I mean, it's hard in labor, it's hard for women, it's hard for people pleasers, it's hard for people who suffer from good girl syndrome, which I used to. I don't anymore. Who wants to
I
be a
can't
good girl?
tell. I can't tell, HeHe.
Yeah, who wants to be a good girl anymore? But, for the people who are like, I don't want to be that patient that you were talking about, Amber, right? I don't want to be that person who is perceived as like a bad patient, or I don't want to go against my doctor. I don't want them to think badly of me. I don't want to hurt their feelings. I don't want them to think that I don't think that they know what they're doing. It has nothing to do with that.
Yep.
They are allowed to have these skills, and you are also at the same time simultaneously together able to be autonomous and make your own decisions. Your doctor is not an authority over you. They are an authority figure, but they don't have authority over you. And those two things often get conflated.
Yeah.
And that's where a lot of women can slip down this slippery slope of not actually being able to advocate for themselves because it feels impossible. It feels really hard and it feels very taboo.
Yeah.
That is a huge mindset shift right there.
Yeah.
What you just said. That they're an authoritative figure, but they're not authority over you is
Hmm.
a game changer.
And
I
those
think women
mindset
need to
shifts
remember that.
are hard. Oh,
Go ahead.
sorry.
No, it's okay. Women need to know that and remember that. That like their birth is their birth and they're the only one that has to live with the outcome of their birth for the rest of their life.
That's key right there, right? Is that this is just another Wednesday in the office for your doctor.
Yep.
It's just another day in the clinic. But for you, this is lasting. When you get that cervical exam at 38 weeks and they do a sweep without consent, you're going home feeling violated, taken advantage of with birth trauma, maybe with sexual trauma, maybe with PTSD from previous experiences that are now being drudged up,
Yeah.
right? They go on to chart for 5 minutes and now they're on to their next patient.
Yep.
It's nothing to them. They didn't even think twice about it, right? Depending on how they have their personal practice set up, this may be something they do to everybody. They
Yeah.
may not have even thought twice of how unethical it is. Maybe
Yeah.
this is just their norm, where for
Yeah.
you, the emotional after effects can be huge depending on your health history or your sexual history or your abuse history or
Yeah.
anything. I mean, even how sensitive you are, even someone who doesn't have a traumatic history, but you're incredibly sensitive, you trust the people around you, you trust that people aren't going to take advantage of you, to be taken advantage of a medical professional that you've trusted wholly. Oh my gosh, that could destroy someone with a very sensitive heart.
Yeah.
Absolutely.
Yeah. Absolutely. Okay. I think this is a great segue into the mindset because you're kind of talking about that mindset of switching from women are the authority of their own birth, of their own body. They can have hired support. And I think we also, I really want to like blatantly say, we hire our providers. It is no different than hiring a personal trainer versus hiring a dog walker. They're hired professionals. You are not like, there's no like legal demand, at least not in the US, for any of these things. So I think that mindset shift is huge. So I think when it comes to the birth world, and I don't know, I'm more in like the home birth center world, I would say. And so I hear a lot more about mindset of, oh, you like work on your mindset before birth, or you have to surrender to birth and stuff like that. Amber, I think you have more exposure to hospital birth. Do you feel like, or he also weigh in on this, do you feel like that gets talked about with hospital as much? I personally
Like
don't feel like it probably does.
like from an educational standpoint, you mean?
More of like I imagine you don't hear OBs saying
Oh
like,
no.
work on your mindset before birth, right? You know, but you will hear that from midwives, or at least the midwives that I'm surrounded by, or doulas that I'm surrounded by.
So I had
Is that
midwives for my first birth,
okay?
at least for prenatal. You don't know this, but I ended up with an emergency C-section. So I had midwives up until my daughter's birth. Go ahead,
They
Johanna.
were hospital midwives, correct? Or were they birth center
They
midwives?
were hybrid, kind
Okay,
of.
okay,
Again, lack of resources in our area. They delivered at the hospital, but they had their own clinic that then
okay,
delivered at the hospital. With them, we talked a little bit about mindset during prenatal stuff. Appointments were like 45 minutes to an hour. I could ask all the questions. Granted, I was also a first-time mom and not in this world like I am now. So I didn't have a lot of the education. I was the first of all my friends to have babies. So I didn't know what I know now. But that was talked about a little bit with my OB. No, mindset was never once brought up, ever. Yeah,
I think that OBs aren't traditionally trained in that, right? They
not,
they
no.
look at birth as like a very medicalized event. They look at it as this really, even if you're low risk, they look at it as a really high risk, very dangerous event. Where I think if you're more into the naturopathic world and not naturopathic medicine, just like believing that our bodies were made for birth because they kind of were,
Yeah.
you kind of recognize that can birth be dangerous? Sure. Do dangerous scenarios come up in birth? Yeah, for sure. Are there high risk populations within the whole birth spectrum? Of course, there always will be, right? Are there bodies that are, I hate to say better, but Some pregnancies are just harder. Some pregnancies are, and it can be in the same human. Sometimes you have a great first birth and you get to your second birth and you are just like so high risk. You're like, am I even in the same body? Right? There are just differences, and we can account for that without making everyone fall into this high risk category. And so I think that's the difference between OBs and midwives and doulas. And so when it comes to prepping for your birth and your mindset, I think there's a lot that has to be done, but you've got to be willing to unlearn kind of the patriarchal ideas of, well, I have to listen to my doctor. Well, if my doctor says it, it must be true. Well, it's disrespectful to ask questions. None of those things are true. Just because your doctor says it doesn't mean it's true. You are allowed to ask questions. Just because your doctor suggests it doesn't mean you have to do it. And we've covered this in the episode already. You have rights. It's
Mhm.
really important for you to know those. I think mindset shift too around that hierarchy. And I like to think about it as a totem pole. And this is how I present it to my clients is typically at the very top of the totem pole, we always think about our providers. And I really encourage you to shift that. They need to be under you and under your partner.
Love that.
Super weird. It's super weird to think that the number one is you and the number two is your partner and then the number three is your provider. Can I give you a like anecdotal personal story about this?
Please.
Please,
Yes.
yeah.
So I'm planning a home birth. I'm having my baby in the next month or so. And one of the biggest discussions between my husband and I has been that we don't need our midwife's permission to transfer. So my husband is a medical provider. He is an EMT, so he's not like a
Interesting.
hospital. He's not an MD, he's not a physician. He is in healthcare administration. So we have a very interesting dynamic in our home. And very interesting dynamic.
Yeah.
And so, throughout this journey, I have been incredibly open and encouraging to him that even if our midwives don't think it's time to transfer, but he and his dad brain, in his husband instinct, or in his EMT training believes that we have a reason to transfer, he should have every right to come to me and say, okay, I've kind of had like all I can take here. I really think that we need to transfer, and here it is. Not I've had all I can take in terms of watching this or being comfortable, but I'm starting to feel unsafe. I know you so deeply on an intimate level. We've been together for 11 years. So he really knows me inside and out. If I'm starting to struggle, if I'm showing signs that he's uncomfortable with, but our midwives are continuing to say, this is normal, this is safe, but he's feeling unsafe. I want him to be able to come to me and say, I don't feel safe. I'm not sure. I really am unsure about this. And then it leaves me the discretion to say, I feel safe. I know that this is the first time that you've done this. Luckily, I have 10 years of experience going through births. I feel safe, and this is totally alarming. If you didn't know this was normal, I'm sorry I didn't prepare you beforehand. This feels good to me. Or I can say, oh my God, this is the permission I've been looking for. I was hanging on to everybody telling me I could still do this at home, but it feels really good to have you say, I'm allowed to transfer. Not that I need his permission, but sometimes in labor, women can get into this labor land or this birth brain where you're just looking for permission. You're just looking for somebody to be on your side and say, hey, it's okay. It's okay for you to get that epidural if you want. It's okay for you to transfer if you want. It's okay for you to decline that cervical exam if you don't want it. It's okay for you to ask for Nubane or Stadol or some sort of sleeping medication to help you get through the next couple centimeters, because we can really, as women and as people pleasers, that good girl syndrome again popping up, we can get into these places mentally where we want to please the people around us. We want them to be proud of us. We don't want them to look at us as weak or like a failure. And that can sometimes be to our own detriment. And so I think that giving your partner that permission to say, you're allowed to say things, you're allowed to disagree with our provider, you're allowed to bring questions to me, you're allowed to make suggestions, you're allowed to advocate for me. I want you to be an active participant, especially if you have a male partner who has never been through birth before, they are going to be standing in that birth room unless they've taken some sort of course. Like I have the Dad Days course and it teaches men how to advocate in the birth room. Unless they've done something like that, which is so hard to find, there's basically no resources for men out there for birth. They are going to be standing in that birth room being like, I don't know what to do. And it's not their fault. It's not them being dumb or not understanding what's going on. They simply don't know what to do. They simply have never been taught how to advocate. They don't understand the birth process. And so that's why I'm a big advocate of having your partner be part of your birth education. It'll also help you with your mindset. When you get to the end of labor or the end of pregnancy and you're like, oh my God, I'm so tired. Oh, I just want this baby to come. Your partner can be that mindset reinforcer and say things like, I know you're so tired and we're so close, but don't forget, if we wait for spontaneous labor, it's going to be everything that you've dreamed of. And I believe in you, and you're so smart, and you look so sexy pregnant. I really don't want you to not be pregnant anymore. I love seeing your sexy pregnant body, right? It's really nice to have a partner that is on board with your goals, understands your preferences, and is willing to go that extra mile and truly be that active participant in that journey with you. It really does make all the difference. In opposition to that, having a partner who also says, "Oh, I'm ready for you to not be pregnant anymore either," or, well, should we just get the epidural? I mean, it'd be easier. I'm ready for a nap. I'm like, I'm so tired. You got to be tired. You want a nap? That sucks.
Yeah.
Especially if you don't want an epidural, you're in a place where you're looking for some encouragement and your partner can't even show up for you as the leader of your family, saying, if you want the epidural, I support that, but I know how strongly you felt, and I'm telling you, you can do this. Why
Mhm.
don't we go get in the shower? Let's try a change of scenery. Let's try a different position. Would you
Yeah.
like me to go ask the nurse for a birth ball? It worked really well in early labor while we were still at home. We could probably get one in here. I might even be able to get some ice packs on your back. Do you want me to do that? That is so different than a partner who is, you know, almost
Checked out.
lazy. I mean, I hate to call it that, but there
It's
are lazy
true.
partners out there who just don't want to be part of the labor process and it's going to hinder you.
I
Yeah.
do my last birth prep call with all my clients. I encourage all of their partners to come for this exact reason. And I will tell you, my gals that have, in my eyes, the best outcomes are the ones whose partners are very involved. And getting those stories at the end of, yeah, my husband so stepped up at the end makes my heart so happy. Because when you're anyone listening that's had a baby or even attended a birth, where you talk about like birth brain, hee of like all you can focus on is like what's going on. It's really lonely at times in that bubble. So to have someone, whether that's a doula or your partner, ideally both, that gets it and can support you is
Mhm.
such a game changer.
And it
Like,
doesn't look like much. It doesn't have to look
no.
like a lot. It literally looks like holding her hand, and in
Yes.
between contractions, you offer her a sip of water. And while she's drinking that sip of water, you say, I'm literally blown away by how strong you are. I mean, I'm crying right now. I
I
just
know
think about
you're
like
making me
how
cry.
amazing that is. Just think
Yes.
about the women who
Yeah.
don't get that. It
Yeah.
literally breaks my heart. But think about also how many people have been on the verge of giving up, getting an epidural, saying, I can't do this, choosing a C-section because they're so tired,
Yeah.
and they hear their partner's voice saying, You are the strongest woman I know, and you look great doing this. And then they're able to get through it. It
So true.
literally just, it makes me, I'm a hopeless romantic. I love the idea
So
of
you're good.
literally just I erupt with just pride. I'm just so proud of those couples, and like that is truly what every woman deserves. It really is.
I sent Johanna a reel a couple days ago of a home birth. And it
Yeah.
was of a
You made me
husband and a wife.
cry.
And I bawled
Yeah.
watching the
Uh-huh.
video and I was like, this is what I picture your birth being like.
Yeah.
Yeah.
It wasn't even my birth. But it
Yeah.
was like so beautiful. So I totally get what you're talking
I
about.
think it can be so simple.
Yeah,
What he said, I think I really want to reiterate this. It can be it's just being a partner. It's not being an expert in birth. It's not knowing exactly what to do. It's not knowing, or it's not trying to push down fears or not communicating fears. It doesn't have to be so complicated. It's
present.
just being a partner to the one you love, right? If she was hungover and puking, you would probably get her some sparkling water in a bucket and maybe pull her hair back, right? Like birth hopefully is a little, honestly may not be that different. But
Seriously.
it's like she may just need to like have her hair pulled back and told that she's doing really good and reminding her of her wishes before, like that you did feel really strongly about unmedicated and you can do it and I believe in you.
Yeah.
And
If
I
you
think
don't
it
know
can be
what to
so
say,
simple.
if you don't know what to say, that's a great one. I believe in you.
Yeah.
Yes.
You're doing great.
Yeah.
This is really hard. You make it look easy,
Yeah.
right? What would you say to an athlete? That's
Yeah.
so easy. What would you say to your favorite athlete? Tell your wife that.
Yeah.
Say it to her.
Yeah.
She deserves to know how strong and how hardworking she is to bring your baby into
Yeah.
this world. And I think that's lost on a lot of men. They
Yeah.
think about this as a really siloed event for women as, well, this is something I can't really do. And it's, oh no, she's doing the hard work, she's doing the laborious part, but you have a huge role. I mean, you're basically the bubble around her, and that's really important. And if you're not there, then anybody and anything can get to her, and it's going to disrupt labor.
Yeah. Yeah. Well, and
Absolutely.
how beautiful of a relationship builder in your marriage can like really blossom and strengthen your marriage in something like that. Like I've felt my husband and I's marriage strengthen even just with pregnancy. Like I
Yeah.
feel like we're connected at a completely different level than we were, 7, 8 months ago. And I was in Fred Meyer 2 weeks ago. Like I started crying because I started thinking about him at our birth and like him being a dad. And I'm like, that's just, it's so cool to be able to go through that with someone. And I think our society doesn't encourage men to do that. And then men also then don't know. And then there's also men are freaked out by birth and, oh, don't look at the vagina. And it's just like it could be so much more wholesome and connected and supportive and make a huge difference in the outcome if we had it much more of a partnership type situation.
I agree. I feel that same way. That same closeness has grown between my husband and I in pregnancy. We just feel, I mean, we've been together for 11 years. So
Mhm.
honestly, going into this, I was like, I mean, how much closer could we get? We don't really remember life without one another,
Yeah.
At this
Yeah.
point, it's like we've been together for a third of our life. You get so much deeper. It's
Yeah.
just like a more intimate connection. And it's kind of weird because they aren't pregnant and it takes them
Mhm.
a couple months to be able to like really understand pregnancy because they're not feeling the bloat and their boobs aren't sore and they're not feeling the fatigue and they aren't throwing up every day and they don't really feel the baby. And even when you feel the baby, there's still several weeks, sometimes even months before you can feel your baby on the outside. That makes it really real for a man in
Yeah.
a different way than it does for the person who's carrying that baby. But yeah, that intimacy that comes along with pregnancy, I'm really looking forward to our birth. I also feel very lucky to have a partner like that. And Johanna, I know you do too, but not everyone is that
Yeah.
lucky, right? Some
Yeah.
people don't have partners who can set aside their ego or that male fragility. And that really is what it boils down to, is men being so fragile that they can't let down their guard. I love Dr. Britta Bushnell's work around this, and she talks about the yin and the yang of the male and the female and how we actually do need both in birth. And without one being able to truly fully show up, it causes this pull, and then the other has to basically overcompensate, and now you have an uneven distribution of energy. And how can we expect birth to go well
Yeah.
when we have an uneven energy and that woman can't fully relax and release because she doesn't feel safe or she doesn't have a partner that's fully showing up for her? That's hard.
Yeah. Yeah. Which I
Very
think
hard.
in that situation, maybe that's where a sister, a friend, a mother, we can outsource something. I also think, ladies, you can always not have your partner there too, which like
Mhm.
that is kind of a tough reality, but like sometimes maybe that's going to be the best decision based on your relationship too. And I think that's where kind of coming back to you're the authority of your own birth and your experience in your body because you are the only one that lives with the outcome of it, right?
And when we look at history and other cultures, there are other cultures that don't kick men out because of the same reasons we just mentioned, that they can't show up, but because it is such a sacred feminine event that men are not really allowed. They're not even invited in. It's not that they've been invited in and then they get kicked out because they didn't act right or they weren't able to kind of show up. It's that this is a woman's experience and you are attended by the women in your village, your moms, your sisters, your aunties, your midwives, the medicine women, the wise wisdom that comes from that deep femininity. That's who shows up for you in labor. And when we look at how other cultures do it, I think there's a lot that we can learn, but we've got to unlearn a lot of the American ways first. But there's a lot that we can learn of how we could support women better. And I couldn't imagine having my baby without my husband, but I'm really lucky to have a great husband where I think there's a lot of women out there who could definitely imagine just being surrounded by that feminine energy and being supported by other females. And yeah, I like what you say. I think that's a really it may be a brutal reality for your
Mhm.
partner, but for you, this is a time to be selfish. You have to choose yourself over anything else during birth because you only get to do it once. We don't get any redos.
Yeah.
Yep. On this note, I think this is a great segue too into talking about like the environment of
Ah,
birth and how that plays into mindset. I know you focus a lot on like the hospital setting, so I would love for you to touch on that because I think we hear often that you can't have that nice birth environment as easily in a hospital as maybe you can at home or a birth center or things like that. So can you touch on the mindset piece of the environment that you're in when you're in birth?
yeah, absolutely. I mean, they're intersectional, right? You can't take one out of the other, and you're going to see that your environment impacts your mindset wholeheartedly, 100% through and through. And so if you walk into a hospital room or a birth center room that is bright lights and it smells sterile and there is beeping of equipment and there's a bunch of faces that you either don't recognize or they're covered up by medical mask and shields and you can't see faces and names on badges because the professionals have their badges turned around. You're not going to feel safe. This is just not conducive to birth. We know that in the animal world, and it would be true in the human world, when we leave spontaneous labor to do its thing. It's not true now because we have chosen to make this massive shift to induction and controlling the onset of labor. But should we let labor naturally play out as it should, most births will go into labor during the night. They almost always do in the animal world. I grew up on a farm in Mississippi, like I mentioned, and almost always you wake up in the morning with a new calf, right? It's very rare that you have a mom laboring during the day. Typically, she went into labor during the night and is now having some trouble. And so, when you had cows laboring during the day, we were always watching them a little closer because it typically indicated that something might be wrong. Same thing would happen with human women is we would go into labor during the night. And so you have to think about that. It's quiet, it's calm, there's solitude, you're by yourself, it's dark. There's no distractions. There's no hustle and bustle of the world. There's no people coming in and out. There's no cervical checks every 2 hours. There's no rotation of the on call schedule. There's no housekeeping coming to empty your garbage. There's no one delivering a meal that you didn't order and aren't going to eat. There's none of that. It's just quiet and you're allowed able to kind of go into yourself. If we don't set up a conducive environment for labor, we can expect that your labor is either going to stop or going to really have a hard time progressing. And it's just
Mhm.
something that I see you both shaking your heads. It's just something that we see. And
Oh
it's
yeah.
like you can't refute it. If you're a doula, if you're a midwife, if you're a nurse, if you are a doctor, even if you're an anesthesiologist and you get reports this person's labor is progressing great, and you get in there, and all of a sudden they didn't have a contraction the entire time you were putting in that epidural. It's probably you.
Totally. I mean,
It's
how often
probably
do you hear
you.
women labor at home for a
Totally.
long time, and they get to the hospital and they're like, everything's stalled out. Why'd everything stop?
Yeah.
Totally.
Well, and then it gets blamed on the woman. Oh, my body stalled. My labor stalled for some reason. Or my body just couldn't do it. Or I got to 9.5 centimeters and then I stalled, just like last time.
That's a big one. So let me give a big tip. And this is something I teach to all of our clients is when you transition to the hospital for labor, don't make any decisions about adding anything to your body for at least 2 hours after you get into your L&D room, you get it quiet, and you have gotten your environment down to the place where you want it. There's no one coming in and out. You don't have a revolving door of humans. No one is trying to check your cervix, place an IV, get a blood pressure read, put on EFM monitors. It's dark in there. Maybe you're in the shower. Maybe you've asked for a birth ball. It doesn't mean 2 hours from the time you arrive at the hospital. You probably have some time in triage. Maybe that's 20 minutes. Maybe that's 3 hours, depending on your hospital, depending on how busy they are, depending on where you are in labor. It's not 2 hours from the time you arrive at the hospital. It's 2 hours from the time that you get into your labor room and get that environment to what you want it to be. So you may arrive at the hospital at noon. You spend 4 hours in triage. You finally get to a labor and delivery room. You've got another 45 minutes to get your room kind of settled, get your IV placed, have your electronic fetal monitors put on if you're consenting to that, have them check your blood pressure and your temperature. Now we're 4 hours and 45 minutes from arriving at the hospital. They're probably going to want to start Pitocin. You've been there for a while. I always encourage people to say, can we have 2 hours just to see if I can't get my body back on track? Chances are you will be able to, but your environment has to be right. We have to get back in our mindset. I'm safe. I can do this. My baby is safe. I'm surrounded by people that I love and love me and trust me, right? I know what I'm doing. This is what we're talking about with your environment. And like I say, they're intersectional. You cannot have one without the other. You're never going to feel safe in a bright, lit up, sterile smelling, beeping room. You can have your nurses silence all of the machines that are in your labor and delivery room. You can have them silence them. If hearing the EFM monitors, the electronic fetal monitoring system, whoosh in the background is really disrupting for you, have them silence it. Have them turn it down. They don't need the sounds. Your nurses are reading a strip of paper. They're reading kind of like an actual printout, and it also projects on computers in the middle of their nurses' stations. They don't need the sound. Sometimes it's comforting, though, for you to hear that whooshing and you're like, oh, my baby sounds so good. They're strong. Listen to that heartbeat. This is amazing. Cool. Have them turn it up. I have had nurses put towels over the computer screen because it's too bright. You can bring Christmas lights, holiday lights, twinkle lights, put them up. There are these little balls that like project stars and moons or, the solar system on the ceiling. Bring that. Bring essential oils. I don't recommend a diffuser, but I recommend bringing cotton pads. You can put the essential oil on the cotton pads, lay them around. It diffuses in the room. If at any point your kind of, olfactory system kind of goes haywire. Sometimes you start to smell things and you're like, that is making me so nauseous. Where for 4 hours previously, it was smelling great. We can pull up those cotton pads and either put them in the garbage, tie it up, and put it outside the room, and it'll dissipate quickly, or you can flush them. It'll dissipate pretty quickly. There are so many things. You can bring a white noise machine. You can make a playlist. You can ask that nobody but your nurse comes in and out. That's it, one person. And then if the doctor or midwife needs to see you, the nurse needs to come to you and let you know and get your permission, right? So it's okay to even say, not even my doctor is allowed in here right now. I really just want my nurse in and out. You also don't have to have that. You can have her put a note on your door that says, nobody is to enter this room for 2 hours. I am napping. I am getting in the shower. I just need some peace and quiet. Do not enter this room unless it is an absolute emergency with me or my baby. And, your partner can play that safeguard. They can kind of stand right there. One of my favorite roles as a doula is when I send a couple into the bathroom, I usually will grab a chair and I'll sit right outside the door of the bathroom, and I'm kind of like a gatekeeper. And, if someone comes in and I'm just checking in, I'm like, yeah, we're all good. We're good. That's it. That's
Go
kind
away.
of the end of the discussion. Yeah, I don't have to say go away, bye bye, but it's like very cut and dry. We're great. I can hear them in there, or I just checked on them. She's doing awesome. She just had a couple sips of water if you want to document that, but otherwise they're just like they're rocking and rolling. They're doing a little nipple stim. That's it. And then, that nurse has to ask, well, can I go in? And at that point, I say, they asked for nobody to come in. Let me check and make sure that's okay with them before you go in there. Then it's on the nurse. You don't always get respected. I've definitely had nurses that say, I'm going to go in. And I'm like, okay. I mean, you're probably going to get yelled at by that partner because they literally asked not to have anybody come in. And my people know their rights. So my people will say, what are you doing in here? Know that I actually heard he tell you not to come in, right? My people are not shy to say, why are you disrespecting us? And so that's that. And, not all doctors and stuff are going to take kindly to that. Sometimes doctors get really perturbed and they don't like it when you speak up. And sometimes nurses feel a little threatened when doulas speak up and even when the patients speak up. But at the end of the day, it is your right.
I kind of think about it like a hotel. You go stay at a hotel, you're paying to be in the hospital, you're paying to be in a hotel. You put like the do not disturb sign on the door. But we assume we go to the hospital that someone can just come and go at all times. But like you are paying to be there. Granted, if there's an emergency, we want someone to come in. But to
Totally.
have that freedom to say, I've never heard anyone say this before. You can tell people not to come in. I never heard that.
Totally.
I literally love this. I'm going to be telling
Yeah.
this to my clients now. That is really freeing to be like, no, I would, because you get interrupted all the freaking time. Like middle of the night, every like hour. Oh, time to do this. Oh, I'm like, how am I supposed to sleep? And then we wonder why we're like so sleep deprived.
You
So
can't sleep or eat.
no. So like the idea of, hey, I don't want anyone to come in right now or just my nurse, that is amazing.
Another thing that you could do is ask your nurse to stack all of her stuff. So the next time that you come in, could we actually get all of our checks done?
Ah,
I don't mind a cervical check, but if we could check my cervix, you could do the blood pressure check, we could check in on my baby with the Doppler, and you could check my temperature all in one go. I'd
yes.
really appreciate that because after that, I would really love an hour or two without anybody. And hospitals have different policies around timing. So it's going to be a big ask for you to not have anybody check in on your baby via Doppler or EFM for an hour or two. If that feels good to you and you're like, I know my baby is safe, they have looked great this whole time, and I'm okay taking on the risk that comes with that, then you should not be afraid to ask that. Typically, we're checking your baby every few minutes, a couple times an hour in active labor, and then during pushing, it's pretty continuous typically. But anything that can be done with those belly bands and those paddles that are worn can also be done with a Doppler, with the exception of two things, an epidural or Pitocin. Both of those quote unquote require continuous fetal monitoring. The risks are a little bit more steep, right? A little steeper with that, but it doesn't mean you have to consent to it. It just means that those two things do often interfere with healthy, strong fetal heart tones. And so if you were to experience some sort of dip, if you didn't have electronic fetal monitoring on at the time, we would miss that.
Super helpful.
Yeah.
I'm going to be taking so many nuggets away from this to now
Yeah.
talking to my clients. I'm like, I'm adding this to my presentation. Like
Yeah. Yeah.
gold, girl.
I
I'm
love
just
it. I
like,
love it.
it's funny because like we're not planning on doing a hospital, but if you transfer anything like that,
Yeah,
I think I'm gonna have my husband like us go back and rewatch this episode just because I think it's
totally.
so powerful. There's so many things that him
Yeah.
and I could take away together, and so hopefully this is for our clients and listeners as well. Just because I
Yeah.
feel like there's such good information that needs to be talked about that isn't talked about, or it is, but you have to find the right platforms for it, and not it's not always like mainstream to be found.
Is there anything along mindset? Because I want to get to our like rapid fire. I don't want to take all of your time either. I want to get to our rapid fire questions real quick. Is there anything around mindset and birth or Johanna, a question that you have that we have not covered yet that you're like, oh my God, all women need to know this about mindset and birth?
Yeah, your mind will give out way faster than your body does.
Absolutely.
Every single time. Every single time. So while I believe that you should be doing endurance training and strength training in pregnancy, movement, walking, stretching, for sure. Super important. ACOG recommends 150 minutes a week. So that's either 3 50-minute workouts or 5 30-minute workouts, right? We want to be working out for sure. Even more importantly is preparing your mind. I can do this. I'm strong. I know the right choices. My intuition is going to guide me. I'm strong. I can do this. I know the right answers. My intuition will guide me. Pick mantras that feel good to you. My baby will tell me if something is wrong. My body is able and capable. I am strong. I am the boss,
I
right?
like that one.
It really depends on what do you need. Are you someone who has traditionally in your past really maybe not appreciated your body as much as you should have? I would focus on body stuff. My body is strong and capable. I am meant to birth this baby. My baby and my body are going to work together. There's no contraction that's stronger than me, right?
Mm-hmm.
If you're someone who typically second guesses yourself, I am all knowing. My intuition is going to guide me. I am my own boss. No one will make decisions without my permission, right? Reinforce those things. If you're someone who is scared of birth is not to be feared but embraced, I can do this. My birth is going to be everything that I want it to be. I am not fearful of birth. I am birth.
Good.
My labor and I are one. My baby and I are one. Every contraction brings my baby closer to my arms. There are millions of mantras online. ChatGPT is another great one. You can literally say, I am struggling with this in pregnancy. Please give me 100 mantras that will help me prepare myself for labor and or that I can use in the labor process. It'll spit out 100 of them. Pick 25 that feel good to you. You know,
Mm-hmm.
write them on note cards. Hang them up in your birth space, in the hospital, in the birth center, at home. Print them out on note cards and hand them to your partner. We just talked about partners may not always know what to say. They got
There
a
you
list
go.
of questions. Flip through them. Every contraction, flip it to the next one. Don't be afraid of birth. You're doing amazing. Every contraction is bringing our baby closer to our arms. You're working so hard. You look beautiful doing this. Every single contraction, remind yourself of your why. So, yes, I think that reminding yourself that your body can last in labor. It's meant
Mm-hmm.
for that, right? Think about endurance sports. Obviously, there's training for that, but for the most part, your body will be able to last in labor. It's your mindset. Our mindset just gets us so quickly that halfway through, you're liable to be, second guessing yourself or
Yeah.
second guessing your body. Whereas if you can reset your mindset, it'll carry you all the way through.
Yeah, I
Love
love
it.
that. I think a follow-up question I have is for women that like to feel in control,
Mm.
because I think probably 95% of women like to feel in control.
I hate girlies.
Yeah, a lot of women like to feel in control. How, and I think kind of on the same note, we also hear about surrendering to the process and surrendering to birth, right? Any suggestions? How would you coach this for a client that is trying to control everything, but clearly you cannot control birth? What advice, how would you coach them?
Yeah, you can have both, right? So your control is not in what happens in your labor. It is in the decisions that are made in your labor. You don't get to control when you go into labor, but you do get to control what happens when your water breaks. Do you go in? Do you go to bed? Do you pitter patter around your house? Do you bake cookies? Do you spiral mentally? Do you call your husband home from work knowing that you're not having contractions yet and he's probably fine to stay at work? Right? What do you do? That's where your control comes from. Your control is in the decisions made, not how your birth unfolds. You don't get to control how well your baby tolerates labor, but you
Yeah.
do get to control knowing that if you're on your back, get into hands and knees. If you have Pitocin, turn it off. If you have an epidural, turn it down,
Yeah.
right? You have control and you have to surrender. You have to be open to surrendering to whatever happens while knowing that you get to be in control of how you respond to what
Yeah.
happens.
Cool.
And I think that's the big piece that gets missed a lot. People will say, well, I don't want this to happen. And it's, well, that may happen. So now what will you do? Do you know your options around that? Do you know the discussions that are going to be presented to you in the hospital setting? Do you know when it's appropriate to transition to the hospital? Do you know how your partner can support you in that? Because you not wanting that to happen, it may
Mhm.
happen. That's
Yeah.
not really in control. That's up to your body and your baby and luck and nature and chance and anything else, hormones.
And I feel like sometimes turning a blind eye could feel like your control because you're like, oh, I don't want that to happen, so I'm just not even gonna think about it. That almost feels like control because you're like, meh, but by doing that, you're actually letting go of the control, which is kind of interesting.
Yeah, for me, I don't know that's letting go of control as it is just like you're not preparing.
Yeah,
Like you're
true.
literally just leaving an entire
Yeah,
bucket empty where you
yeah,
could fill your bucket with information, education, options, resources, preparation for your partner, discussions that you could have in prenatals, understanding the various things that may happen after that. So,
yeah,
again, going back to that example of your water breaks, okay, now we know your contractions are either already going in your water breaks. They have not started in your water breaks, or your water breaks and there's meconium present. All three of those are possible. You have different options at different places, right? With each of those scenarios, you have different options and you have different responses and reactions that you can do.
yeah,
If you don't know those things, then when that happens, pretty much the only response you're going to have is to spiral because
yeah,
you didn't do the work to know what your options were when it happens. And so I totally understand. I mean, it's not so hard with water breaking, but let's talk about something more scary, shoulder dystocia. Everyone's so scared of shoulder dystocia. Terrifying. Legitimate emergency for sure. Requires true timely response, requires a truly trained medical professional, appropriately trained. One of the easiest ways that you can resolve shoulder dystocia in almost all cases is get on hands and knees. If you didn't know that, then you're going to
yeah,
be subject to one-step delivery. You're going to be subject to McRoberts. You're going to be subject to all sorts of maneuvers that are commonly used in the medical setting, in the hospital specifically, sometimes
yeah,
in birth centers. At home birth, though, they're going to say, your baby's a little stuck. I need you to get on your hands and knees,
yeah.
right?
Yeah.
So
My
different.
midwife actually said, I can't remember if she said it on our episode, Amber, but she had actually said, I would prefer to handle shoulder dystocia versus in the hospital. Everyone thinks that the hospital is necessary for shoulders, but she was like, midwives often handle it way better because it's just changing the position or maybe getting in there and actually helping release the shoulder. But a lot of the hospital situation like that doesn't necessarily happen and then it becomes like this big like boiling medical emergency and it could have been emergency but if you have the right trained professional which goes back to in the beginning of the conversation you're like you went through how much school and you can't deliver a baby that's not on like when the woman's not on her back like it's a little concerning.
Okay, this transitioned into our rapid fire questions perfectly because the next
Yeah,
question I want to ask is kind of along these lines. So my thought process here, Hee, is you just give like the first off the cuff thing that comes to your mind in regards to these questions, okay? All right,
Got it.
first one. What's your opinion on vaginal breech and twin births?
Do it. They're totally safe with the right trained provider.
Heck yeah. VBAC.
Do it. They're totally safe with the right trained provider.
I love it. What is delayed pushing or laboring down? Can you explain it? And when might this be appropriate?
Totally. So delayed pushing, laboring down is when you get to 10 centimeters, but you're not having that urge to push. It's appropriate when you get to 10 centimeters and you're not having that urge to push. So just because you're 10 centimeters doesn't mean you need to push or you have to push as long as you and your baby, your vitals are all looking good. And here's a little key to like knowing whether you should labor down or not. If someone is having to tell you it's time to push, it's probably not time to push because your body will engage in something called the fetal ejection reflex and it will push your baby out for you.
yeah,
Literally love that because so many people think as soon as they hit 10 centimeters, it's let's push. And then like people are like, I pushed for 5 hours or whatever. I'm like, ah, okay,
You
love
could
that.
have labored down for 4.5 of
Yeah,
those.
exactly. I know most people don't know that. Your opinion on epidurals?
Get it if you want it. Understand the risk and benefits, but yeah, it's totally up to you. I think it's a great tool for a lot of people. Also, if you get in a place where you're just like truly exhausted, it can really help you get to the next stage of labor.
Johanna, you want to ask that last one? I feel like we covered the other ones already. So ask
Yeah.
your last one.
You've already alluded to this, but I wanted to put a point blank question for mamas to hear. Can you decline literally anything in the hospital, even if it's policy?
Literally anything. It's literally the law. It is your human right and it is medical freedom. Literally anything.
There's not one single thing that you like have to do.
There's not. If you become incapacitated in any way, then your providers do assume consent. But in that, in that situation, typically you're unconscious or you're very mentally unwell and you are not in the right mind to make decisions for yourself. However, even then, your partner should be able to make decisions for you. But if you do become incapacitated, then your providers do have assumed consent.
Cool. Yeah, I think that's super important to hear because I think so many women don't know that.
No, no.
Yeah.
Okay.
Amazing.
That was such an amazing episode. I cannot, from Johanna and I both, like we cannot thank you enough. We've been really looking forward to this episode. So thank you. Before we let you leave, if there was one piece of advice that you could give to all the women listening, or even maybe men that are listening, who knows? What is one piece of advice that you would give to them?
Know your rights. Know that you are your own boss. Know what you can and can't say no to. All those, there's nothing. And know your why, right? Understand why you're saying no to the things that you're saying no to. Understand the reasons that you're saying yes to the things that you're saying yes to. And stop blindly following the system. The system does not have your best interests at heart. That is an ugly reality. I wish that wasn't so. I don't think that's our forever, but it is our reality right now.
Absolutely. Okay. Where can everyone find you? HeHe.
Well, on Instagram, I'm at Tranquility by HeHe. I'm also over at the.birth.lounge. If you're looking for childbirth education, it's thebirthlounge.com/join. And then my free education is on my podcast, The Birth Lounge Podcast.
Love it. We will put all of this in the show notes for everyone to find as well. So
thanks for having me, you guys. This was
so
fun.
much.
Thank you.
Yeah, it was amazing. All right, guys. We'll see you on the next episode. That's a wrap on today's episode. Thank you for hanging out with us on the Wild and Fierce podcast. If you loved this conversation, we'd be so grateful if you left a review and shared it with a friend who needs to hear this.
And if you really loved it, take a screenshot, share it on your stories, and tag us. We'd love to see it. Until next time, stay wild, stay fierce, and keep owning your journey.